Trillium Gift of Life Network is a service agency established in 2002 and mandated to operate, to manage, to coordinate the multiple partners who are responsible for organ and tissue donation and transplant. We exist for the patient on the wait list. We exist to provide them the organs and the tissues that they need to live and to move forward to collect the data on the outcomes of their transplant so we can feed it back into research and practice and obtain better outcomes for them. If we look at the total number of deceased organ donors across Canada, 54% come from Ontario. In the last 5 years, we've had a 22% increase in deceased organ donors. We've had a 77% increase in 5 years in tissue donors.
Trillium Gift of Life Network, through public education, is working to build a culture of organ and tissue donation in Ontario. The call to action is to encourage the public to help save lives by registering their consent to donate organs and tissue. beadonor.ca website is the portal to Ontario's online organ and tissue donor registry where residents can register and check their registration status. It's very easy to use. It takes 2 minutes and all you need is your health card. Since 2011, when the online donor registry was launched, registration rates in Ontario have increased from 17% to 25% today. So 2.9 million Ontarians have actually made the choice to register their consent to donate organs and tissue and help save lives.
The Provincial Resource Centre is really the hub of where the activity of organ donation and transplantation takes place. The call centre here takes calls from every hospital in Ontario relating to a death or an impending death. Coordinators are dispatched to the hospital where an approach to a family and consent for organ donation may occur. The coordinators here match the donor potential to the transplant recipients on the list, start arranging recovery as well as transport of the organs back to the transplant centres. What is different to most call centres is we actually allocate all organs centrally here in the office. This allows the coordinators that are on site at the hospital to focus on supporting the family, to ensuring that they're aware of the process, and also to support the donor management in the intensive care unit with the healthcare team. It also is really important for the coordinators here to be able to focus on making every phone call possible to place these organs, whether it be within Ontario or within Canada or within the US.
Physician-to-physician education is one of the strategies that Trillium uses to reach out to ICU, Emerge, and other physicians involved in donation so that we can educate those individuals on best practices in organ donation. Our job is to provide high-quality end-of-life care, and if we do that in a way that incorporates organ donation, we're going to save lives.
Have you called Trillium Gift of Life Network to report David's death?
For us as physicians, as we talk to other physicians, we want to provide them with expertise to allow them to comfortably integrate a normal conversation about symptom-based management, about organ donation, using our expert to approach the family and offer that opportunity when it's possible. We are selecting, along with the hospitals, a physician at each major hospital to champion donation at that facility. A hospital donation physician will be responsible for education, will be responsible for quality assurance at that hospital, and with support from Trillium Gift of Life, they can provide physicians in that institution, nurses, and other healthcare professionals with the tools necessary to make sure that we work effectively together.
TGLN and the Toronto Lung Transplant Program have had an excellent partnership over many years in terms of improving the yield and improving the performance of lungs that we use for transplantation. We've developed a technique to keep the lung at normal body temperature outside the body, and that actually allows us one, to measure it better, to see how it's working, but more importantly, to treat it, to remove lung water, to treat inflammation, so that we can actually improve the organ. In 1 year since we introduced it, has increased our number of transplants done by 28% in 1 year, and that's unprecedented in the history of our programs. Right now it's for lungs. We've shown that it's possible. I think the future is extension of this concept to other organs. Really, it's opened the door to more advanced therapies of the organ itself before transplantation.
Every family has the right to make a decision on whether to give the gift of life. And any step that precludes the opportunity for that decision is a medical misstep. Death is not the last step in life. Death is the step before the decision to give the gift of life.